you suffering from the hip pain first thing in the morning? Your hips are very stiff when you get up from the chair and you're feeling so much pain, you're limping, you're feeling sharp pain in your hip joint when you twist or turn or standing, then I have this exercise video for you to take a look at it and follow. So what happens is, most of the time when you have any pain in the joint or the muscle, we keep strengthening or we keep stretching, but sometimes joint needs stretching and the muscle needs strengthening. If you combine strengthening and stretching, then only you get the result. So this video is the combination of stretches and the combination of strengthening that can complete your rehabilitations. So without any delay, let's check it out. First of all, we are going to discuss 5 stretches that we can do to help the hip joint and the muscle mobility. And then we will follow up with the strengthening exercise or the stability exercise that can stabilize the hip joint. A lot of this hip joint pain is either because of your joint or arthritic or some capsule. On top of that, you can get also trochanteric bursitis as well. And this exercise mostly works for all of them. Now, if you have issues like if you have a fracture in the hip joint, if you have a avascular necrosis of the neck of the femur, then you should consult with your physiotherapist or doctor before doing these exercises. So first stretch is the supine hip flexor stretch. This stretch is very important because it targets the hip flexors, which is iliopsoas in the front of the hip joint. Now these muscles are usually tight because our lifestyle is designed in the bending. We sit a lot, drive a lot, and hip doesn't get chance to extend and this muscle never gets a chance to get stretched. This can also cause back pain because these are attached in that area. So how do you stretch this? It's very typical stretch. You usually haven't seen this, then it is good idea to practice first. So what we do is we go on the edge of the bed, one hand, so one leg hanging on the side, and then you pull the opposite leg towards your chest. And when you try to do this, your hanging leg might lift up because of the hip flexor tightness. You are stretching the hanging leg here. When you pull the opposite leg, you are just stabilizing your pelvis. You can do this stretch for 10-second hold and 5 repetitions on both sides. These are the hip flexor muscles usually responsible for sometimes clicking and popping. This is the iliopsoas. This exercise you can also do for clicking or popping joints. Second stretch is standing hip flexor stretch. Similarly, you can do this standing. If you are working in the office and have a lot of standing job and can't find time to go on the back, and you can also use this as an alternative, what you do is you take a big step forward, and then we are going to move the front leg and bend the knee forward, and you're going to feel this stretch in the back leg. If you don't feel it, you can arch your back a little bit backward and feel the stretch. Hold for a few seconds, again 10-second hold, 5 reps is good idea. If you are feeling sharp pain or pain in the joint or the buttocks, maybe something else is going on too, so just check it out. You should feel a stretch when stretching. That's it. Third stretch is hamstring stretch. Now hamstring can be stretched in many positions. We want to do supine hamstring stretch where you are laying on your back. So what you do is you go on your back and then grab your thigh from behind using your both hands and clasp your fingers so you're locking that position, and then try to extend your knee and lift your heel up. So you're straightening up the leg, but it won't straighten up if it's tight. It's okay, as long as you feel a stretch is the goal. Then you can pull the foot in towards you. So you pull the foot in towards you and you will feel a calf stretch as well, which is helping your hamstring and the calf to loosen up, which helps your head, which helps your hip as well. So then you do this for 10 seconds, again 5 repetitions on each side, and you can repeat this with your other routine. Fourth stretch is the gluteus muscle stretch. What you do here is, if you have a joint issue in your hip joint or replacements, don't do this stretch because this is one of the contraindicated position for the hip replacement. So what you do is, first of all, you go on the bed or on the floor Bring the front leg with the 90-degree bend, and the back leg is 90-degree bend opposite way, like this. And then you're going to bend forward, and you will feel the back stretch too, but this is your gluteus stretch on the front leg, and it's very intense stretch. If you can do this stretch, this can be your best stretch in your routine, and it can help a lot. Again, hold for 10 seconds. You can repeat only maybe 3-4 times. Don't need to do too much because it is very important and intense stretch anyways. So yeah. Fifth stretch is the piriformis stretch. Piriformis is one of the muscles that can bother you in a deep hip joint pain, and also can cause sometimes sciatic symptoms. So this stretch is important. What you do is you go on your back, cross your leg, one of the leg, and then use your both hands to pull your knee towards you, thigh towards you, and then you will feel a stretch in the leg that is crossing. This very intense stretch. Again, we can repeat same thing on the other side. Cross your leg and then pull the other side with using your both hands, and then feel the stretch. Hold for at least 10 seconds or 20 seconds and repeat 4 or 5 times. If you feel pain, sharpness, you should take it easy. Sometimes piriformis can create radiating pain if your sciatic nerve is pinching. Then you want to take it easy by not going so far. These are the 5 stretches we can do. Now let's move on to the strengthening component. Strengthening is important as much as stretching is important, but there is no replacement. There is no alternative. First exercise is the strengthening of the hip abductors or the clamshell. This is gluteus medius strengthening. These are the stabilizer muscles. It's very important. So you go on your side, bend your knees and the hip 90 degree, and then you're going to open up your knees and make sure we do this with good stabilization and core activation as well. Then you move into the next exercise, which is prone hip extension, which is the gluteus maximus strengthening. Gluteus maximus is important muscle as well, and this can be done at least 10 reps, 3 sets. You go on your tummy and you straighten up your back leg and strengthen the gluteus. Third exercise is supine hip SLR or hip flexion strengthening. Hip flexion strengthening, you go on your back and you lift your leg straight up to 45 degree, not too high, and then you can repeat this 10 repetition 3 times maximus. So you're strengthening the back, side and the front, all of them. If you like this kind of content, please like, subscribe and share. I have other video where there is also showing about the gluteus muscle strain, then you can check it out. If it is your hip joint that's bothering you, then this is good, but if it's your gluteus muscle, then you can check this video out.